Welcome back to the Racing Mind video series, where we journey deeper into the human mind than anyone has ever gone before. In this video series, we untangle the ancient mystery of mental illness and teach you what you need to know before your racing mind gets the best of you. This groundbreaking series provides answers to some of the deepest mysteries of the human mind and reveals, for the first time in history, the precise cause of mental and emotional illness and the psychophysiological basis of a wide range of psychiatric disorders and associated medical conditions. These educational videos, which present concepts that are so new that they are just beginning to make their way through the medical field, are based on thousands of hours of direct patient analysis and clinical observation in conjunction with the latest research on psychiatric disorders from around the world. In this segment of this series, we will discuss obsessive-compulsive disorder in relation to neuronal hyperexcitability. Obsessive-compulsive disorder, more commonly known as OCD, is characterized by obsessions, which are repeated thoughts, and compulsions, which are repeated behaviors that do not serve any productive purpose. Identical twin and family studies indicate that genetics is the most important predisposing factor for the development of the disorder. This, taken together with the observation that family members of persons with OCD have either the same or another psychiatric disorder that appears in a classic Mendelian distribution, strongly suggests that OCD is rooted in the same gene abnormality as these other psychiatric disorders. As discussed in video 2 of this series entitled How Gene Variants Translate into Psychiatric Disorders, the proposed abnormality is a variant of a normal gene whose protein product fails to adequately regulate the firing of neurons. This lack of regulation causes persistent anxiety and various thoughts and feelings to keep replaying like a broken record. In most cases, it also causes the affected individual to develop various behaviors and routines aimed at undoing the perceived cause of the anxiety. These behaviors and routines may include such things as repeated hand washing, repeated lock checking, compulsive cleaning, compulsive neatness, and compulsive hoarding. All these behaviors, however, are as exaggerated as the fears and concerns known as obsessions that are driving them. Moreover, persons with OCD generally realize that their obsessions and compulsions are abnormally extreme, yet they feel powerless to stop them. The simple explanation for this is that the related cognitive emotional circuits in the hyperexcitable brain won't shut off. The reason that cognitive behavioral therapy can be helpful is that it trains the mind to stop stimulating the circuits that are pathologically hyperactive. Over time, this reduces the excitability of those specific circuits, thus reducing symptoms. It does not, however, correct the underlying genetic problem of neuronal hyperexcitability. Consequently, one set of rituals may become replaced with another set of rituals. The most common precipitant of OC symptoms is persistent emotional stress, as this has the effect of further increasing the excitability of the neurological system. Certain inflammatory illnesses, such as Group A beta hemolytic streptococcal infections, can have the same effect because inflammatory cytokines likewise increase neuronal excitability. Like the symptoms of other psychiatric disorders, such as bipolar disorder, cyclothymic disorder, cyclic depression, generalized anxiety disorder, and panic disorder, OC symptoms tend to wax and wane in severity and come and go in association with stress, thus providing additional evidence that OCD, like these other psychiatric disorders, is rooted in a hyperexcitability of the neurological system. As discussed in previous videos, the most effective natural ways to compensate for the gene abnormality that underlies neuronal hyperexcitability include stress reduction, establishment of an early sleep schedule, regular exercise, enjoying a relaxing hobby, avoiding caffeine and other psychostimulants, and minimizing refined sugar. If these interventions are either too difficult to implement or fail to yield satisfactory improvement, then treatment with neuroregulators and other brain calming medications may be necessary, particularly during high stress periods in the person's life. In addition, Cognitive behavioral and other forms of psychotherapy may be needed to reduce the mental tension that adds fuel to the smoldering embers in the hyperexcitable brain. Control your brain, control your life. We hope that you are benefiting from this video series. Portions of this video and others in the series were taken from the books The Racing Mind and Am I Depressed or Am I Bipolar? Those interested in developing a deeper understanding of this topic can also refer to the scientific publication, The Multi-Circuit Neuronal Hyperexcitability Hypothesis of Psychiatric Disorders. Please note that these materials in this video series are for educational purposes only and are not intended to guide treatment without formal evaluation. This video series is sponsored by the Binder Foundation, a charitable organization that is dedicated to the enhancement of human life through research and education on disorders of the mind, body, and spirit. If you have found this video to be a benefit to you, please share it with your family and friends. And please don't forget, your feedback is important to us.